So I see a lot of patients who have had a few children and their breasts are sagging, and they say to me, I really want this, doc. And they just kind of lift up by the palms of their hands and say, that's what I want. I really want my volume back. I want my breasts back the way they were before I had kids. So in most patients, a combination of implants and a lift work best. What we're doing is we're using the implants to restore volume in the upper part of the breast, and then the lift part removes extra skin and breast tissue from the lower part of the breast. So it's really a plus minus solution. And patients understand that. They know that their breasts have been distorted with time and gravity and just the aging process. Now there's more than one type of breast lift. There's one type where the surgeon just removes extra skin around the nipple and areola called a donut lift, which sounds like a good idea, but it isn't. It really doesn't get the job done. Another type is the inverted T or anchor scar lift, and that's the way most North American surgeons were trained, including myself. But the problem is it leaves a pretty long scar, and it's like an anchor scar. And the scar under the breast goes from one side to the other. So it's a long scar, and the breast looks boxy. It can look wide. The nipple can look a little too high. So it doesn't have an ideal appearance. There's another type of breast lift. It's called the vertical breast lift. And that's what I learned to do about 20 years ago, and I've been doing it ever since. It gives a better cosmetic result. Rather than taking out a horizontal ellipse, the surgeon takes out a vertical ellipse, and that makes the breast more conical, tighter. It's a much more effective lift, and importantly, there's less scarring. Nipple sensation tends to be better. It's safer. So really, always you look at it, the vertical lift is ideal. Sometimes often there's still a scar underneath the breast in the crease under the breast, but it's not nearly as long as that inverted T anchor scar. So a very common combination that I do for patients is a combination of implants and a vertical lift.